Okay, so another technique that I want to tell you about is the forearm extensor technique. This one, your person is placed in pronation. This would be if you have some trauma in here in the forearm with the extensors. Maybe you've had like a trauma here or surgery, or maybe there's just a scar here from an injury that's interfering with movement of the tendons. So then you could do a cross hands technique on the extensors, and it's the same kind of thing. I'm crossing my hands. I'm just putting light pressure. The degree of pressure is very small. So it would be as if it's not much more than me just resting my hands on Monica's forearm, okay? It's maybe a little more than that, but not much more. So I'm really just resting, and again, I am trying to stretch things out and waiting for 3 to 5 minutes. So okay, sorry about that. Had to pause to grab a towel. So basically what we're trying to do here with myofascial release is we are trying to straighten out the fascia. So when you get an injury, it's sort of like your fascial structure is all bunched up because it's trying to heal that area, okay? So that is going to impair the muscles and the tendons from moving properly because it's going to get in the way of that. Then there's going to be scar tissue. You can think of it as just throwing a bunch of sticky glue in there, and then it's all just kind of not moving well. So when we do our myofascial technique, so this is my cross arm, right? And what I'm trying to do here is I'm trying to smooth it out, okay? And so I'm going like in this direction where I'm kind of pushing outward, and I'm trying to have the fascia lay down in an organized, straight way. So that is what is going to help us to help our patients, because part of the pain has to do with the muscles and the tendons being held back. They're being held back and they're not able to move the way they should because of that going on in the scar tissue. So we're going to try to straighten it out, and that can help resolve pain and actually help people move better. So that's the explanation about myofascial release.